Hi, I am Dr. Krishnamohan, Yarlagadda. I am Clinical Director and Head of the Department for Department of Surgical Gastroenterology, Minimal Access and Bariatric Surgery. So, we are discussing about hiatus hernia. You might have heard a term called hiatus hernia. Hiatus is nothing but a hole in your diaphragm. So the stomach is going through the hole and sitting in your chest. And because of that, you will feel chest burn, you will feel pain abdomen, you will feel nausea, and even sometimes the food, whatever you have masticated and swallowed, it may come back and into the throat. Or sometimes you may get dry cough continuously. Whatever the medicine you use, it may not go, and people continuously roaming around the hospitals for dry cough. But the problem is not dry cough, the problem is your acidity, and acidity is due to your hiatus hernia. So unless otherwise you diagnose and uh, treat the root cause, you may not get relief with any kind of medication. Of course, lifestyle alteration is required, eating on time, sleeping on time. This is very much important for hiatus hernia patient. But you need not suffer with this for rest of the life. The treatment can be done in 24 hours. The moment you visit us, exactly it takes 24 hours for the relief. The moment I operate on you, it is completely cured. And this is done by robotic surgery or by laparoscopic surgery. And there are no further complications too. So it is such a simpler and easier approach for the problem hiatus hernia. Thank you.